Hello, Dr. Minkoff.
Hi, Michelle.
Can you describe to us the different stages of Lyme disease?
Sure. You know, I think there's sort of a pre-stage. I was in Wisconsin recently. My brother has a cottage out there, and we were in the woods walking around. And there are a lot of deer in Wisconsin, and in the area that they're in, these deer have ticks, and these ticks get in the trees and they get in the dirt, and when you walk around, you can get ticks that fall on you. And lo and behold, when we came back from a couple of mile hike, I said, you know, we better look at everybody, take your clothes off, let's search to see if anybody got a tick. And out of 7 of us that were walking around, my brother had a great big tick on his back, and my grandson had a tick in his hair. And we pulled those ticks off, and that would probably be sort of pre-stage or potential Lyme disease. Now what occurs then is if those ticks are on the body too long, when they bite, those ticks are infected with multiple organisms of which we call Lyme or Lyme complex. And those organisms can get into the bloodstream of the patient. The usual acute reaction is that the patient within a few days may get a rash. It's sort of a typical, it's called a bullseye rash. Erythema marginatum is the medical term. Usually accompanied by some chills, some fever, some achiness. Sometimes the rash never appears. Sometimes the other symptoms are very mild and the person misses it, or the doctor misses it, or nobody thinks of it. And then after that, there's a period where there just isn't any symptoms for a while. Sometimes within 3 to 6 months, or even a year or two later, the patient then starts to have vague kinds of weird things. Their arm gets a little tingly, their memory's a little bit fuzzy, they start feeling anxious for no real reason. They may get a little bit of a tremor. They may have problems with sleeplessness. And this is the Lyme organism that has gotten into their nervous system, or they may start complaining of joint pain or joint swelling. And they'll go to a doctor and he'll say, gee whiz, it looks like you may have early rheumatic disease or autoimmune disease. When really, this is the spirochete that is mimicking other things or masquerading as other things. And then as this progresses, it can go to full-blown, seriously late problems with these areas where it's severe rheumatic disease, what looks like Parkinson's or multiple sclerosis or ALS even, where people are pretty much devastated from the bacterial organism and its toxins and the immune response that occurs from it. So that's kind of the spectrum of it. And you know, if you get it early when the tick hasn't been on very long and you pull it off, that's the end of it. If the tick has been on for a while, a couple-week course of antibiotics will kill the bacteria that get in there, and you're done with it. My experience is that after that period, once there is chronic rheumatoid disease or serious neurological disease, that antibiotics long-term just aren't usually effective. People take them for a month or 2 or 3 or a year, but the thing seems to come back. And what we found is that if we can correct the other underlying problems and use non-pharmaceuticals to kill the Lyme disease, there are lots of herbals, essential oils, silver, ozone, that we get it better, we cause less problems with the host, with the person, like we don't mess their gut up with long-term antibiotics, and we don't kill all the energy-making mechanisms in their cells with long-term antibiotics, that they actually do better. So I would treat someone with antibiotics with acute symptoms, because I think that's the right thing to do. But someone who comes in with long-term symptoms, I almost always avoid it because it just doesn't seem to work.
Okay, thank you.